Dissociative Identity Disorder, or DID, is a very severe disorder. DID is a disorder where there are two or more distinctive identities or personality states in one body. These personalities can take control of the body. The dominant personality can experience memory loss or lost time due to this takeover. A device isn't a set of instructions, it's more like a paint supply store. You give the seeker the colors and the canvas, it's up to them to make something of it, or ignore it altogether. DID was called Multiple Personality Disorder until 1994, when the name was changed to reflect a better understanding of the condition. The personalities are more like fragmentations rather than a separate person. The takeover is not usually due to direct psychological effects of a substance or medical condition. Because of many factors, an accurate diagnosis of this disorder is controversial. This disorder has a primary identity that tends to carry the others. Each personality might have its own name and its own set of emotions that can be extremely different from the primary or dominant one. Certain circumstances or stresses can cause an alternative personality to take over. The personalities might not know each other or even be aware of the others. Alternatively, some of the personalities, including the primary one, may be in open conflict. The report range of identities is 2 to more than 100. Half of the reported cases include individuals with 10 or fewer. Symptoms of depression, anxiety, passivity, dependence, and guilt may be present. Most DID persons experience problem behavior and an inability to focus in school. Self-destructive and/or aggressive behavior are common to both outside persons and in between the personalities, as well as visual or auditorial hallucinations. The average time that eclipses from the first symptom to diagnosis is 6 to 7 years. How can you help someone with DID? Be empathetic to them. DID can be a very frustrating and physically exhausting disorder. Having someone for support is a great way to help. However, you should be aware that all the personalities might not like you. Sometimes, those with DID hear the voices of alternate personalities talk to them, even when they are in their dominant identity. Try to keep an open mind when talking to other personalities and treat each one as if they were a completely different person. Don't be judgmental toward a DID person. It is hard enough to try to sort through your own personalities without having to deal with outside pressure and embarrassment. Treat them with decency and respect. Seeking help is not a life sentence. Once you can manage your disorder, it can no longer rule your life. Please note that any advice I give here should be taken with a grain of salt. Everyone's life is a different story, and these are merely generalized tips. Results will vary. If you would like to ask me for advice, please email or Facebook. My links are in the description below. I know you can pick any YouTuber to watch, so I just want to thank you for picking one of my videos. I hope it helped.